New medicine educator and practitioner. I met and had my first appointment with Dr. Katherine Willow, ND, which is naturopathic doctor, in 1998. She's the founder and owner of Carp Ridge Eco Wellness Center in Carp, Ontario. Back then, Dr. Willow did not use or know anything about German new medicine. She was introduced to it in 2001 by one of her patients who held out a book and told her that she had to read it. German new medicine resonated with her, and she recognized its importance to well-being and healthcare. Today, she focuses on integrating German new medicine into her practice. I first heard about German new medicine when I went to an open house at Carp Ridge Eco Wellness Center, where Dr. Willow did an introductory talk about it. I listened with an open mind and decided that what I was hearing made a lot of sense. I think the other listeners were feeling the same way because the room was so quiet, you could have heard a feather hit the floor. Later, as I thought about what Dr. Willow had said, I felt a kind of relief. My mother's family had a lot of heart disease and quite a few thyroid problems. My father's family had lots of cancer, lots of cancer, and a lot of heart disease as well. I felt as if I was in a genetic time bomb. That short intro talk made a difference to my thinking. Although most people, practitioners, alternative and otherwise, patients, have never heard about German new medicine, I feel really happy and privileged to have been introduced to it. Now, as a toast tonight, with all that being said, I'm glad that you will be getting an introduction to German new medicine from a German new medicine educator and practitioner, Dr. Katherine Willow, naturopathic doctor. German new medicine may start you thinking differently about how you view health and disease. So my toast this evening is to Dr. Katherine Willow, to German new medicine, and to your good health.
Your good health.
And the first person on our agenda is Jim, and Jim is going to give us our word of the week, and he'll be our grammarian. He'll tell us what he'll track as the meeting goes on. So let's welcome Jim.
Thank you, Ma'am Toastmaster Lynn, and fellow Toastmasters, esteemed guests, and new folks that are enjoying our meeting. Today's word, whenever you say it, you get a little tick beside it, which tells me that you're doing an amazing job improvising, but also adding in new challenges. Whoever gets the most will, of course, hear their name once more at the end during my brief but thorough grammarian report. Today's word is proactive. Proactive. An ounce of prevention is worth a pound of cure is the main one I've heard. Whether you're going to go into the hot tub to relax for a little bit or learn about new German medicine to figure out better ways for your whole self to become healthier, the word that we want to use is proactive. Proactive. So I'll put it in the report here, and I look forward to hearing it a lot. Back to you, Madam Toastmaster.
Thanks, Jim. Good word, because we all should be proactive with our health. And I think Katherine will give us ways to look at health tonight that will help us be that way. So, Katherine, are you ready for me to introduce you?
I thought you already did.
My introduction to Katherine Willow as the speaker. So she's the special guest tonight, and she'll be speaking about German new medicine. I think you figured that out already. So, Dr. Katherine Willow is a naturopathic doctor and German New Medicine educator and practitioner. She's a fourth-generation naturopathic doctor and has been practicing since 1983. She graduated from the National College of Naturopathic Medicine in Portland, Oregon in 1983 and is registered with the Canadian College of Naturopaths of Ontario. Dr. Willow enjoys helping people with aging well and prevention of disease, allergies, cancer, children's conditions, especially ADHD, fatigue, fibromyalgia, inflammatory conditions, Lyme disease, weight gain or loss and detoxification, and women's health. One of her focuses is the integration of German New Medicine into her practice. Another favorite of Dr. Willow's is old-style naturopathic medicine, which approaches disease with the simplicity of nature cure therapies: sun, air, water, earth, and plants. She has written a book. Title is German New Medicine: Experiences in Practice, an introduction to the discoveries of Dr. Rika Gerd Hammer. Let's welcome Dr. Katherine Willow.
Thank you. It's a pleasure to be here. It's a nice groove. So let's dive right in. So my talk is about an advanced mind-body map, which correlates the emotional causes of diseases and helps us target better treatment plans. And I have to apologize about my voice, but I'm going to explain later how it fits right into this talk. So the notion of stress causing disease is not new. It's been known for decades. I remember back in the 80s and 90s, people would say things like, well, 80 to 90% of what walks into a doctor's office is stress related. And then in 1995, a group of researchers did a long-term study on trauma in children. And they studied things like neglect, abuse, addiction, crime, and divorce was a big one, and noticed that significant influence on people's health. They had more cancer, mental disease, cardiovascular disease. So this mind-body map that I want to share takes this notion to a much bigger degree of precision. So what it does, it can predict the exact type of trauma that connects to a specific condition. And where that comes from is millions of years of evolution. So we already know that a general response to stress is fight, flight, freeze. But what's been discovered is that we also have these very specific responses to stress. And the kicker is that these specific responses are the body's attempt to help us with that stress. So in this whole system, this mind-body system, there's a map. There's a chart behind me on the wall. Oh, there, orange and yellow. It's very wide, very intricate and detailed. There are a lot of technical pieces to it. And so instead of trying to tell you about those technical pieces, I've decided to tell you about cases. First of all, it's more fun to hear stories about people. And second of all, that's how I learned that this actually works. I never use anything in my practice that's just a theory. If it doesn't work, I throw it out. And within pretty short measure, after implementing this in my practice, I saw things that just astounded me. So I'm going to share some of those with you. And then please, while you're listening, because this is very counterintuitive, it's very different from how we have understood disease. Because it's much more than just stress causing disease. There are lots of other bits. And you'll see when you hear about my laryngitis, how it's not a disease, how it's a healing process, that you'll understand some of that. So please, as I'm speaking, it's helpful if you write down some questions for later, because I don't know if you know this principle, but if you hit something that doesn't make sense, your mind will spin around it and you'll miss the next paragraph or two. So immediately, write a little question, and then your mind will be free to listen. It takes quite a while to learn this material. When I have patients who are using it, I often recommend that they read my book several times and keep looking at questions, studying with other teachers, taking courses, reading different books, because again, it's sometimes 180 degrees opposite to what we think we know about a certain condition. Okay, so one of my earliest patients, and I'm going to change the names to protect privacy, was my friend Joan, who I had seen for years in only proactive ways because she was splendidly healthy. And she came in with the diagnosis of ovarian cancer and the prediction that she would die in 3 months if she didn't do the regular cancer treatment. So I said, Joan, I've just learned this new mind-body map, and it tells us that there are very specific traumas that connect with certain conditions. And the one that connects with ovarian cancer is a loss conflict, usually a death. And we figured out that she had had a devastating miscarriage about 15 years previously. And now here's a complication that might, well, I'll say it a few times with the different cases, but some of our cancers grow when we actually have the shock. So they're stress phase cancers. Whereas other of our cancers grow when we resolve the stress. So they're healing cancers. So you can think of it this way. You can think of when we have stress, that there's stress damage. And some of our cancers are a healing of that stress damage. And the ovarian cancer is one of those examples. So what happens is that the ovary grows. Remember, I said that the organ's trying to help us. So the ovary grows in order to help the woman have more hormones so that she's more fertile and she can conceive another child, because there's been usually a loss. Or if she's lost a mate, she'll become more attractive due to these hormones, and she'll be better at attracting a new mate. So you can see how this is very primitive. A lot of these programs don't make sense to us. Well, this one does, but a lot of the other programs don't make sense because they're related to when we were fish, when we were one-celled creatures, when we were, millions of years back in the evolutionary scheme of things. Or if you don't believe in evolution, we just contain these programs. So when we're embryos, we actually go through all these stages. We start as a one-celled, then we move up through the fish stage. We actually have gills at one point. When we're in utero, we lose the gills, and then we go on to emerge as human beings, but with all of those programs intact that would have triggered a fish, a one-celled creature. And so in modern life, we have lost the awareness of the connection between these primal programs and our modern life stresses, because our modern life stresses aren't usually life or death. Whereas millions of years ago, it might have been life or death, not to be able to procreate, not to be able to have another mate. So what we figured out was that Joan had had the miscarriage, let's say it was 15 years ago, and her whole life was focused around, I want another baby. She had one child already. She wanted more. And so when a shock hits us, we actually get lesions in the brain that you can see on a brain CAT scan. And the size of these lesions, they're like target rings, concentric circles. So some of them can be quite little, some of them can be quite transitory. So let's say we're watching TV and we see a war scene, we might get a shock, but it's not our family, it's not our people. Again, our primitive instincts are to be concerned with the people who are close to us, who are local. So then that shock would be gone in a few minutes. But let's say it's my son who's fighting in that war and he gets killed, then that would be a shock for me. Same kind of shock that Joan had, the loss. So we figured that out. And so her conflict mass, which means how deep and how long a conflict sat in our brain and affected or being resolved, will determine how strong the symptoms are. So we figured out she had decided that when she hit 40, that she would stop trying. And guess how old she was? She was 40. So now the ovary could start recovering from those 15 years of stress. And what happens to the ovary, it actually loses cells during the stress phase of a loss. And the hormones will actually go down. So sometimes people, if they've had a devastating loss, women will lose their period. And it was probably one of the reasons that she couldn't conceive, because she was in such grief. So the body's protecting her from conceiving while she's still in grief. The body wants us to be over the grief before we conceive another child. And that's why the ovary only starts growing when we've resolved it. Now, that might be way too information. Feel free to ask me questions. But what happened next is what I want to share, especially because at that point where she resolved, I'm not trying anymore, I'm letting this go, her ovaries started to grow. Yes. Then she started to have some symptoms. And of course, then she got diagnosed. So we figured that the time when that ovary started growing was around her 40th birthday. And some programs have specific healing times. So you got to remember, this ovary growing is actually a healing of the stress. And ovaries take 9 months to stop growing. And every ovarian cancer, unless there's a relapse into a loss, will grow for 9 months, stop growing, and become a cyst. No longer having cell growth as in an active cancer. So we knew that we had till September and that thing would stop growing. Now, I'm pretty new at this at that point. So I'm hanging on the phone with my teacher saying, it's getting kind of big, because when Jo first came in, she was splendidly healthy. And she totally understood this whole picture, said, makes sense to me. I'm going to take some time off work and go garden. And she didn't tell anybody because she thought, well, my family's going to think I'm crazy for doing this. So she didn't say anything, except to her husband, of course. And she went to garden. And then in May or June, because I said, don't you want to come in and get checked? No, I'm fine. In May or June, she called me and she said, this is getting kind of big. Maybe you should see it. So she comes in, she lies down, and I'm measuring a tumor that's this big. I'm calling my teacher. She said, oh yeah, they can get quite big. And they'll even borrow blood supply from neighboring Oregon until they finish at their 9 months' time, in which case they'll release. So this was all new to me, and I was a little bit nervous. Thank you. And I'm measuring Hannah now every week, like measuring a baby. I don't know if any of you have had children. It's like they actually use a tape measure. It's getting bigger and bigger, and it's like this big. Then we get to September, it's the same. The next week, it's the same. The next week, it's the same, and it has stopped growing. So she found a surgeon who would just take out that ovary. There's not the other ovary. I think she called 10 surgeons. She finally found one. She had it out because it was affecting her gardening. She could have left it in theoretically, because those ovarian cancers that become cysts keep adding to the hormonal level, and keep women younger. So she had it out, and that was in 2003. So she's still alive and kicking and running businesses and doing all kinds of things. So that's one story that I want to tell you. I'll tell you another story of a lung cancer. I do a lot of cancer work, so I have a lot of cancer cases. I have a lot of other things like joint pain. I find it almost easier to treat cancer because it's so clear and people are very motivated when they have cancer to do to do what's required. If you just have joint pain, it's like, oh, it's just gonna limp along with it. So a woman calls me and she's just been diagnosed with lung cancer, and they've recommended that she take out a third of that lung. And so lung cancer is a response to a death fright, because when we think that there's death, the first thing we need is air. So the lung says, okay, I'll grow you more cells to get more air into your body. And when it's one lesion, like one lump, it means we're afraid for somebody else because we're so linked with each other energetically, especially when we were more primal. And when there are lots of little lesions, that's fear for ourselves. So he had one lesion, one lump. And I said, thank you. Oh, I'm done. That's 15 minutes? Wow, that went really fast. When okay, I'll just finish this off. I'm so sorry. I have like pages. I read it. It was 6 minutes. I think I went on some detours. Okay, I'll finish off. So what happened is that I asked him, who's dying around you? And he said, nobody. But my mother died 3 years ago. So then I knew that the lump was done. Because when we have fear for somebody else dying and they leave, there's no fear left of them dying. We then go into grieving, which is but that's the ovary if it's strong enough. And so I told her, you don't really have to have this surgery. How was it found? It was found on a routine x-ray. She had no symptoms. I said, but just go in. Don't break your bridges with your medical doctors. I'm very integrative. Have it checked. It won't go anywhere. By this time, I'd been doing this for a few years, and it was like gravity for me, these new laws, because I've seen so much. And so she went down to the Mayo Clinic for a second opinion, and they said, not only surgery, you need chemo and radiation. She called me in a fluff, and I said, did it grow? No. Do you have any symptoms? No. You can do all your treatment, but you can also watch. You're safe. So she came back, told her surgeon she was going to wait. The surgeon blew at her for an hour, yelling, said she'd be dead in 3 months. So 3 months again. And so she just started to watch it. It never went anywhere. She came in for one visit. I said, you're healthy, go back to work. You have nothing wrong with you. Because these aren't diseases. They're special biological programs that are trying to help us with a shock. So it totally turns around what we think of as medicine. As becomes known, it's going to take things that we haven't been able to treat, and now we're going to be able to treat them. We just had somebody with brain cancer do no medical treatment. And again, I never push, never. It's just, what do you want to do? He wanted to do German new medicine, great. He was my worst patient ever. He didn't follow anything I said. I had to talk to him every week and try and get him back into line. Saturday, we got the brain scan, clear, nothing left. So I'm pretty excited about this. It's why I wrote the book, to try and get it out to other people who can do more research and bring it into medical schools so that we can integrate this. I'm going to stop. It's gone over. So now I'm open for questions. And I still have my voice. Let me tell you about my voice. So laryngitis is the healing process of a fright. So I grew up with violence and have a fright about when people are aggressive. So I have this person in my life who tends to be aggressive, and I'm afraid of them. So last week I had a counseling session, which helped me stay calm when they blew up at me, which was twice this weekend. I was able to stay calm and get them through. I ended up the weekend feeling like, oh my gosh, I'm less afraid. And so all the stress that went onto my voice box, fright is fear. You want to yell, you want to scream, or you can't. It's so frightening, you can't speak. Now this is the recovery of all that stress damage for my voice box. And I'm so proud of my loss of voice. It was very poor timing for the talk. I was very nervous about doing this to go and get through it, but I've gotten through it and I have voice left for questions. So you can just, I don't know how you do questions, but you just yell them out if you want.
Has anybody got a question?
Yes, I have a question.
Okay, go ahead.
You touched on blood cancer. I have a friend who's got some cloning issue. They call it cancer of the red blood cells. And it's not growing fast, but it's one of those watchful waiting things is what they call it. How does that fit with your practice?
I have several leukemia patients, and the shock is a self-devaluation shock. So somewhere where we feel not good enough, put down, slandered. And in the shock phase, our blood cells go down. When we recover from that shock, the cells temporarily go up and then go back down again to normal.
How long?
So what I do, it's dependent on how big the conflict mass is and what self-evaluation is a very common thing in our culture. No one feels good enough, at least in certain areas in our lives. We have a very critical kind of culture. And so it's very common that people are triggered. They relapse back into the conflict. So then it takes longer. You go back and forth. So it can go within 6 weeks. That's the classic, straightforward. But it can also take years of figuring out how to work with self-devaluation. That's why I think we need to be proactive in learning this system and learning the kinds of emotional wounds we have and starting to work with them before they make us sick. So a lot of these programs are actually easy to work with, but they're not easy to work with because we get 180 degrees opposite message from the medical doctors. And I will not fight. I will not put the patient in between like this. I will also always very carefully explain and say, that's that story, that's this story, what makes more sense to you? And if somebody's really scared, I'll say, do your treatment. Because fear causes all kinds of things in the body and makes it harder to recover. So then we do both together, which is not easy, but it's more realistic. Yeah.
Okay.
Thanks for that question. Mm-hmm.
I have 2 questions, Lynn. It's Annette.
Go, Annette.
Thank you. So my 2 questions, one is for myself and one is for my husband. So for myself, I work in an extremely high stress job. And so I have a lot going on. I had a very, very traumatic childhood. And so I'm not sick that I know of. I feel fine. I do
You
the
look very
best,
healthy.
thank you. I do the best that I can to always take time for myself and look after myself and that kind of thing. So I guess I have 2 questions. One question, do you do anything related to like a preventative dealing
Yes.
with stress, that kind of stuff?
Yeah,
And then you do? Okay, so I may look into that further. I have some information.
Yeah.
And then
We're developing a whole new program
okay.
to make this accessible to people so we can put it online in a kind of a step-by-step process so that anybody can access it, because it's expensive to see a naturopathic. People aren't covered. And it's unfortunately the top criteria, the top factor in healthcare is money.
Okay.
It's quite awful, but
I'm very
yes, we
lucky to
try.
have coverage, so in that
Yeah.
side, that's good. But and my husband has a lot of works a very physical job, and he has a lot of inflammation and joint pain and things like that that are making, as he gets older, are making life more and more. I can see it. I can see it just wearing him down. And so I told him I was coming to this meeting tonight, and I would sort of ask you about it, but it might be something I have to take offline with you as well.
Well, briefly, so joints also respond to self-devaluation, but the pain is the healing phase, which causes a loop. Because let's say, I remember my first joint patient after learning German medicine. So she had joint pain in her fingers, and that is a performance conflict. Like she was put down for poor performance typing. And she was told, you'll be on drugs the rest of your life, nothing you can do. And we just explained it to her and said, you need to wean off the drug because the drug is anti-inflammatory, and inflammation is part of the healing process. Now, I don't take people off drugs. And I often, if we do it with the doctor. But sometimes people decide to do it on their own. And within, I don't know, I think it was 3 months, she was playing golf. She hadn't played golf in 5 years. It's just to allow the joints to heal. But if you're doing something and you're hurting, you're going to feel badly about yourself. So how do you crack that? It's not, some of these things are not easy. So you really have to give the person a lot of support. And that's when joints respond extremely well to good diet and cleansing diets. So I'll do that. We were treating lots. We have people who didn't need hip replacements. She told anyone, using a combination of German new medicine and diet. Yeah.
Thank you.
Thank you.
Yeah, I have another question. This is to do about hypertension or high blood pressure. How does that fit in?
It can be part of several programs. In general, it means that there's something active, an active stress.
I'm
So we have
retired.
to
I
look
got no stress, except maybe Toastmasters.
Well, it can be an old stress. Sometimes when we don't resolve things that we had in childhood, they linger, they stick in us, they stick in our body, and we don't know them. I remember getting somebody who was in his 20s and he had some disease that only elderly people get. I said, you're totally healthy. What trauma have you had? And he said, nothing. And it took 6 months before he remembered that he'd been beaten almost to death. 14 years old. The guy went to prison and he'd forgotten. It was only because he saw him. So it was a huge lesson for me, that incident. It was like, I was blown away that he could have forgotten that in 7 years. Totally suppressed it. So we have so much that we carry that we don't know, but the body shows us the kinds of traumas, and we have to be slow in healing them, because you're hearing about healing symptoms. If you go too quickly, you're going from a high conflict mass to none, and the healings can be actually even dangerous. So downgrade slowly. It's much more fun anyway. Get a therapist and go slow. Enjoy the process.
All right, thank you for that. Okay.
I would throw in a question.
You know this
Flus
almost
and-
as well as I do, Lynn.
Sorry, what was that?
You know this almost as well as I do by now.
Flus and colds. They're always like a whole bunch of people have flus and colds at the
Yeah.
same time. Now, people say, okay, you caught a bug, but then it's always been at lectures that I've heard you say the microbes, the bugs are there to help us heal. So if you don't need the bug, you could be swimming up to here in them and you're not going to get sick. But what is this massive thing of tons and tons and tons of people are sick at the same time?
It's partly seasonal because we're just not as resilient when we get into winter. So we're more affected by our stresses. And so then the flus and the colds happen when we have total or partial resolutions of the stress. It's like having an intense work project and then going on holiday and getting sick on the holiday. It's like a letdown. It's sometimes we're so fixated on these bugs. That's a difficult one to teach people, but it's very clear. I mean, even with COVID, I've seen lots of people who tested positive on the test. None of their family got sick. They weren't in a bubble. They were interacting with their family, sleeping with people. No, so we don't see it as a contagion. We see it as people having similar stresses, like winter, like low vitamin D, like, you know, wars, like for instance, when World War II was over, there was the TB epidemic. No, World War I.
Yeah.
That was the relief. TB in the lungs. Remember that fear of death? The TB helps degrade those growths that are no longer needed because you don't need the extra air because the fear of death is over, either for yourself as the soldier or or the family. So these things do make sense in terms of bigger populations. It's hard to sometimes see them because we're so tuned in to the different way of looking at it. And I'm very careful with people, with vaccinations, with all of that. I never push or pull. Whatever I explain how this works and then support whatever people want to do. So colds and flus are a combination of everything. It's stresses, but it's also our lifestyle. So if you eat really clean and have a very good lifestyle, you're going to get fewer colds and flus. There's less congestion in the body for the bugs to act up in.
Can I do another? Okay, I can remember years and years ago, my mother used to say there'd be some really nice person and like a very nice, good person and all in quotation marks, church-going person, like a half saint. And they'd get sick and they'd be dead. And then my mother would say, and here's this other person, and they don't care about anybody, they don't care about anything, and they're lying there in a gutter drunk and so are they just not sick because they don't care, so that anything that comes into them, it's not affecting them? Or are they just like, what's going on there?
Well, I don't know if that's totally true, Lynn. I would say that people who don't have good lifestyles do get sick of the rest of us. And so now the people who are saints who die suddenly, I mean, I don't think it's a matter of whether you're good or rowdy. It's a matter of how you're handling these different wounds.
Okay.
And it's kind of a complex question. And I think if you could take each case apart, you'd understand how these principles apply to each individual case. That's where then the understanding comes. Because we respond to things quite differently.
I'm reading a book right now, and and it's talking about the pain body and how we carry even from the time we're children. Like I came from a very nonviolent family, but that if you're coming from a family where as a child you're witnessing those things and you can't react, you hold it all within yourself as a trauma. And it puts you on constant edge. And then as you grow up as an adult, it kind of makes me think of what you're saying, that if you don't deal with those things and they're buried deep within inside of you, these are the stories that you keep repeating in your own head, which is sometimes why people who've come from an abusive family also become abusive, because it's the only thing they know how to deal with. And that if you can put yourself totally into the present and stop having these conversations that are like a loop, always going on, taking you back, because the pain body feeds off your negative thoughts. You're nodding, but I'm finding this book absolutely fascinating. It's by the guy Eric, the one who wrote The Power of Now. I can't think of his name.
Totally.
Yeah,
Eckhart, totally.
but the book is absolutely fascinating. And I know once when I wasn't feeling well and ended up having to leave teaching, the doctor had wanted me to stop altogether, and I just couldn't, because I loved the career so much, and went back part-time. But he said to me, and I'm quoting, he said, "You're just like Joe Frazier." And I said, "What do you mean?" And he said, "You get smacked to the mat and you get back up again and keep fighting, and you get smacked to the mat." And he said, "It's time for you just to stay on the mat." And that was the best advice, because then I finally went on disability, and it gave me a chance to heal. When I was just home for 2 years and basically didn't even leave the house. But it's so interesting what you're saying about that when you get sick, it's your body telling you that you need to change something. And I find that fascinating, what you said about the people that you were talking about.
Yeah, I had 8 cases ready to present.
Yeah, it really is interesting. And that's
Yeah, there are lots of books. I have one sitting on my desk that I really love. Nothing about German New Medicine. The Body Keeps the Score. Bessel van der Kolk. Oh my gosh,
Who
it's
wrote
so
that?
hopeful. Bessel, Bessel, van der Kolk, Kolk. It's brilliant. It tells terrible, terrible shocks and traumas, but it also is very lifting about what people can do to heal their shocks and traumas. Yeah.
I think
Gabor Mate is another one with The Myth of Normal, 400 pages of how stress and trauma make us sick. Yeah.
And I
It's
think it
coming.
fits into sometimes with a person who's normally really calm, and all of a sudden they snap and just go absolutely crazy. And I remember a student at school who came in crying. And when I asked her what happened, the teacher in the last class had blown up at her, and it was over something very minor. And I remember saying to her that it was the second last class of the day, and that this teacher had probably just been putting up with stuff from 9 o'clock from one student after another, and whatever it was you did just made them blow their cool that they would normally keep. So,
Ah,
but is that the body's way too of kind of suppressing anger all day long, and then something just makes you explode?
yeah, for sure. We do our best to try to keep these primal emotions, appropriate and gentle. We're a kind people. We try.
So then something I saw in a movie where people went in and they took their frustrations out by baseball bat and China, and they just broke all kinds of stuff. And so should teachers maybe be between classes going and breaking things with baseball bats? No,
No, it
no,
doesn't work. No, because it
doesn't
doesn't solve, it doesn't resolve. The quieter, meditative breath work, counseling works much better. It's a temporary relief to hit something, which is fine, but it doesn't resolve it on a deeper level. You'll
okay.
get triggered again. It's interesting because I remember doing some of those techniques, doing scream therapy and all kinds of things like that. That was 40 years ago. And it was only when I learned to really be in touch and be able to hold my pain without having to react, that the pain, like a little child in myself, could calm down. Like when you have a child who's crying and you hold them and they just stop crying just for being held. We can learn to hold ourselves. But it takes it takes a lot. Some of us hold pain that's like touching a hot iron. And often we need facilitation. We need somebody else to hold us, to teach us how. I've had to go through that process. So I know it intimately.
Why is
very,
it they call it German new medicine?
it was discovered by a German internist, a medical doctor in Germany.
Oh, okay.
Yeah, I don't like that name. I would rather it be something more international. It doesn't belong to Germans, even though I'm German background. But that's what it is for now. I like calling it a mind-body map. Yeah.
Brad keeps waving that red card. Does that mean, Brad, you want us to move on? I know I'd like to listen longer, but I guess we can't.
Everybody needs to go do their life. I think we're going over here, so
Or should we vote for another 5 minutes?
I can come back if you want. I can do part 2 if you like.
Another
Sometime.
day?
Maybe with a voice.
Maybe
Can tell
with
you
the
more,
voice.
more cases that show the technical details of how this works. Because there are so many details. Like, don't go out and use this without kind of learning it properly. Yeah.
And even a healing cancer could be dangerous, right? Like I'm thinking of a healing cancer that would be growing inside one of our pipes. And if it blocked something off.
That's right. Sometimes you need surgery.
Okay.
Yeah. Even Dr. Hammer would say, you know, there's room for everything. There's room for chemo. There's room for radiation. There's all of it. You just use common sense and say, well, what is most appropriate for any one situation. I think my most satisfying patients are the cancer kids that I have recently that have been given up and are doing very well. Yeah.
All right.
Do we have time for Sylvia's question?
Should we?
Okay. Brad says yes.
Okay. Brad
Okay.
says yes. Go for it, Sylvia.
Okay. More.
So I know the person, she said that she has a cyst, and I'm not even sure if it's on the ovary. I'm assuming that some cysts are cancerous and some are not, correct?
Yeah, correct.
Right.
But all of them
So-
become cysts.
Pardon me?
But all of the ovaries all become cysts. It's their natural progression that they stop being cancerous.
Okay,
And there's
well,
a whole way of learning that. It goes by brain level, by tissue type. There's a lot of as I said, I keep saying technical detail. You know, it really is a lot of science in this as well. Yeah, that's important to know for the practitioner. For each person, you just need to know your one thing and what is the pattern? How does your condition respond? What's its natural course? And then how to interface with it. How to be proactive. I don't think it's really fair that I get to do all the talking, so I get to use this word. Anyway.
Okay, well, I'll at least introduce her to you. We'll see if she'll come and have a chit chat. Thanks.
Yeah, we run groups too, so it's a cheaper way to get introduced to this, or
And
just to
when
read the
will that-
book. The group is, I think group is tomorrow
Time?
afternoon, 2 to 3:30.
Okay,
And also she can book. It's a lot cheaper than coming to see me.
okay.
To
And
see
have
if it
you-
makes sense. See if it
Fran,
makes
you
sense.
did a
Or is it
message at the
online?
bottom of the screen, which I didn't get a chance to read. What was it? Fran?
Just said if people want to stay after the meeting's ended and Dr. Willow is willing to stay, then people can ask more questions there. But if we carry on with the finishing up the meeting, so if anybody does have to go.
Okay, all right.
Yeah.
Well, then we'll cut the question and answer, even though I'd rather not, but we will. And the next part of the meeting, I'll hand over to the general evaluator tonight, and that's Pam. And let's welcome Pam.
Okay, so